So I'll quickly introduce myself because we don't want to spend a ton of time on the presentation. We want to leave lots of time for questions in that. And Anosha will do a bit of a demo on the race app as well and show people how to use that. So my name is Margo, and I've been working with the race line since we started it in 2010 at Providence Healthcare. My role currently is Director for Digital Health Solutions at Providence Healthcare, and shared care, which this work came out of, is a big part of my work there at Providence. Anosha is our project lead for race, and she makes sure that all of the day-to-day and onboarding of specialists, interacting with new specialties, primary care, she takes care of everything that it takes to keep it up and running. So we'll hear from Anosha in a little bit, and I'm just going to start off here. So how come I can't advance it then? There we go. Okay. So what is RACE? Some of you may know, some of you might not know. It's Rapid Access to Consultative Expertise. It's a telephone advice line. As I said, we started it at Providence in 2010. It was June, so we're coming up to 13 years next month. And it was really started as a solution for a gap in care that had been identified by our Department of Family Medicine. And it was primarily with cardiology, the way it started, because the only way to connect into a cardiologist at St. Paul's was really through the on-call person, and it was really difficult to connect in with them. They were often an emergency seeing patients, and they just didn't have the time to talk to primary care and answer questions. So the initial race line was done with, it was a small pilot that was done just with cardiology. And it had very good results, and we expanded it from there starting in 2010. So what it is, it's a way to connect. It's really just putting a structure in place so that primary care providers, nurse practitioners, family physicians, residents, specialists can call in as well, and as well as midwives, and they can connect in pretty much through one way. We used to have it through a telephone line, but we soon outgrew that because there was a lot of telephone trees when you end up with 40 different specialties, and we're now at 80. So we still do have a few on the telephone line, but we did move to an app, which makes it a lot easier for the connecting in. So telephone advice for urgent advice about a specific patient, your calls are answered in 2 hours. This just gives you a sense of the different specialties that are available. On the far right are the provincial specialties, which provide advice across the province. It doesn't mean that some of these other specialties won't be available for you to choose from. And if someone went in through the app through Fraser Valley and say there wasn't, they don't have geriatrics. If the Vancouver Geriatric Group said, yes, we would like to opt in to provide advice for the province, then the geriatrics from Vancouver would show up. So a Fraser person can choose from them. So it's if the specialty is not listed in your area, and there's Vancouver Island right in the middle, it doesn't mean that you don't have access to some of the Vancouver, because probably most of the Vancouver specialties have chosen to opt in to provide advice. They're just not a true provincial and advertised as a provincial specialty. So these are all listed on our website, raceconnect.ca, and you can, I think we actually have little blurbs of what each one, like a little definition of what each one is for as well, if you were wondering any specifics about them. So in 2015, we built an app because it was difficult for family physicians as well as specialists to capture the patient demographics, the name of the person who was calling, the name of the specialist, all that stuff had to be written down in the moment. And it was a bit difficult. So with the original app in 2015, we made it so that you could just put your information in once, And then for each call, family physician still does have to put in that patient demographic name, PHN, and date of birth. We also had the ability to put a picture in there, because at least that let you know who the person was that you were talking to if you happen to run into them somewhere else. There's a place for specialists. They can make a note in the app for their note-taking purposes. Family physician might likely be in their office next to their EMR, but a specialist might be anywhere. So it just gives them that ability to make a bit of a note. And the specialist could choose how did they want to be how did they really want to be notified that they had a race call coming in? Did they want it through a voice message to their cell phone, a text, an email, or a pager, which there are still a few pages left out there, not many, but a few. Most of the specialists choose the text form. And so a text just comes into their cell phone, says you have a race call. They can tap on it. The family physician's phone number is right there. And then they call that family physician back. In last year, we upgraded the app a little bit more, and these are just some of the pertinent features that might be important to you. There was a lot of on the back end as well as some more on the front end, but password was one of the biggest problems that people had with the app, because we're health authority related. We had to change the password every 3 months. It was extremely frustrating. So we went to a two-factor authentication, and now password only needs to be changed yearly. And I think that it does make it a little bit easier for people. There's also, we recognize that sometimes the calls are not answered within 2 hours. Specialists might be busy, maybe it slips their mind. So they do, at 2 hours, if the call is not completed, the specialist will marked as completed, the specialist will get a text saying, remember, you have a race call to answer. Again, here, I sort of talked about it a little bit, is that people have the ability now to sign in, say, through the North, and open up a Northern race account so that they have sort of first access to their local specialist, because we really wanted to keep that expertise at the local level whenever we could. We didn't want to disrupt any referral patterns or communication patterns. So we really wanted to make that first connection with local specialists if they're available. So those ones will show up first, but if they're not available, then users can choose from the other different geographical areas. And consistent date of birth for patient demographics. That was also another frustrating item, where is it June 7th or is it July 6th? And it just created difficulties with billing and errors. So we were able to fix that one. And as I said, there was several other fixes, but these are just some of the main ones that might pertain to you. I'm going to pass over to Anosha now, who's going to tell us a little bit about some of the metrics. So over to you, Anosha.
Perfect. Thanks, Margo. So hi, everyone. So moving on to just talk more about the RACE metrics. So, RACE has really grown since we started. We do now have over 5,000 primary care users, and this includes residents, physicians, midwives, nurse practitioners, and specialists. We have about 1,500 specialists that participate, and currently we receive around 1,500 calls per month. So that can average to about 18,000 calls per year. We do have over 80 specialists at this point, specialties, sorry, and we add them based on primary care provider needs, or if there are any specialist groups that are interested. We know that from the post-call survey that 90% of the calls are answered within 2 hours, as Margo was mentioning earlier regarding the time frame. And looking back at the last about 13 years, we have had about 85,000 calls to date. Can move on to the next slide. So you can see here from 2017, when we did the provincial evaluation, our numbers have gone up significantly, and same with our specialties, our users, and our number of calls. So now that we have an integrated approach where users can see who is available within their local area and they can register in that area, we've seen a big increase in Northern health numbers as well as interior. Vancouver region have not seen much of a change, and that's likely because, prior to the app upgrades, northern and interior users could not register in their areas. So that's likely, at that time, they were also registering as like within Vancouver. And I'm not sure if, either many of you have had exposure yet within the interior, but they do have a platform in place there that's called Microblogging MD. So that's what they use there to connect with specialists. So, we encourage people there to use that first, but if they can't access to that, then they're of course welcome to use the race line as well. And now that, Providence Health has moved into doing like the whole administration, so the central administration for race, we are able to create this dashboard. So this is really useful in terms of, being able to see the metrics. You're able to kind of see, the number of requests per health authority, as well as, per site, and as well as the responding specialist per health authority. So that gives us like a good idea in terms of numbers. And I think in this slide here, also from the dashboard, you can also see the most frequently requested or called specialty. And so this gives us a good sense of, the top 15 specialties. So here you can see adult psychiatry is currently the number one. And so at the end of like our call, like on the race app, we do have this short survey that comes up. And so that asks the users 4 questions. And so based on those answers, we've seen that about 97% of race users said that they're, overall satisfied with race. 74% of race users said that their call actually avoided a patient referral to a specialist. We had about 73% of race users say that the call avoided an emergency department visit, and about 93% of race users said that their calls are answered within the 2-hour frame. Great. So I think passing it back to Margo to speak more about patient care experience.
Thanks. And we've looked at those numbers, and the survey, where it says 75% avoid a face-to-face or an emergency department visit, 75%. And it just seems really high to me, but that's based on primary care completing the survey right at the end of the call. So to me, that's when the person would likely put in the answer that they truly believe. So I'm kind of amazed at that. I'm surprised, but it has been fairly consistent. And the response rate for that survey is over 50% response rate, which is pretty good. So I just wanted to mention that part. So next steps for, sorry, I can't see the top of my page here because of the Zoom stuff. I'm not quite sure what the title is. I think it's just how race can affect care. When we look at the triple aim framework around patient provider experience, population health, price, the cost per capita, we do think that it is making an impact there. Patient care, patients, instead of sometimes waiting months to have something addressed, it might be addressed within a couple of hours. They may not have to travel and take time off work to go to a specialist appointment. And the provider experience, primary care, they can get their answer fairly quickly without, again, having to wait for their patient to see the specialist. It potentially could improve population health. Specialists are able to see the patients who really need their expertise to see them face to face, and patients may have their healthcare issue dealt with in a more timely manner. And around the controlling per capita costs, that's related to the avoided emergency department visits and face-to-face consults. And let's see, it doesn't really want to advance. There we go. So just some of the next steps that we're looking at for race is to continue to onboard specialists based on what primary care is telling us. The 2 top ones that we've had difficult bringing on are hematology and gastroenterology. On the island, you guys have that available to you. So that's great that they're available on the island. We do our best to bring on specialties. We can't always get them on, but we certainly do approach them and see if we can bring them on. Sometimes specialties come to us and say, hey, we've heard about the race line and we'd like to come on. We'll also continue to make improvements to the model, to the app, really based on feedback. And with some of that feedback, we did a fairly large provincial evaluation in 2018, as Anosha mentioned, and we think that we can get a lot of the answers just through the app, through the metrics and that. So we thought instead of doing a big evaluation, we would do a very short questionnaire, just a bit of a check-in with people. So we hope to have that out in September, and just to make sure that race really is still meeting a need, and do we need to evolve it in any way, and just to get a sense of what people are thinking. So I just wanted to bring your attention to eCase too. I know that's not part of the agenda, but eCase is another expert or advice access to specialty expertise that we have at Providence Healthcare. And it's a non-urgent, within 7 days, through secure email platform. And it's a bit of sort of complementary to race. You can put the request in after hours, a specialist can view it after hours. So it's just that for the non-urgent requests, family physicians and specialists both, they can attach supporting documentation or, you know, a paper on a topic. And as I said, the request is meant to be responded to within a week, but the average response time is within 2 days. And we've got about 28 specialties on eCase at this point. We started in 2017 with that. There's been over 4,000 e-consults that have been answered, and information on eCase is also on the RACE website. We need to sign you up for that secure email platform. So if anyone is interested in joining eCase, we're happy to just, if you shoot us an email, we'll get you on there. And that's it for me. Anosha can do a race demo now. Would people like to see a little demo of the app? No?
That would be great.
Yeah? Okay. Alrighty. Anosha. So
Okay.
I'll stop sharing and you'll start, right?
Yes, sounds
Okay.
good. Okay, so just to kind of give like a general overview of how it works. So this is the web browser version. You also have the same layout on your phone as well when you download the app. But basically, if you don't have an account, you click here to create a new account, and then the directions are pretty straightforward. It'll just show you, terms of conditions, things like that, and then we'd get your request, and then we'd verify you. And so once you have your account, this is how you would log in. So either again on your phone through the app, or you could do the web browser version. So I've put in my email here. I'm just going to put in my password. So once you log in, this is the layout you'll see. So for example, if I were to click here to request a specialist, it would show me all the specialists that are available, or all the specialties that are available for this day. So with RACE operating, Monday through Friday, 8 to 5, as you can see right now, it says off hours for all of them because it's past 5. But, if I were to, let's say, do like any type of test call to test a race, it would kind of show up here in terms of letting me make the request. And then once that happens, it would actually send you a notification to the specialist based on what their preference is to receive that notification. So either through maybe email, through text message, or through a call, whatever they prefer. And then here, as we can see, this is just a tester account. So if I were to click request at this point, it'll say, sorry, the specialist is currently off hours, but had it been before 5, it'll show you a screen in which you can enter your patient name, your patient birth of date, as well as your best callback number. So that information then would do its best to first connect you with the local specialist. And then if they're, not available at the moment, it'll connect you to another specialist. So I'll go back for a second. So just to kind of show you some other features on this is if you were to go to my inbox right now, it won't show that I have any messages, but if you were to receive requests, that's the place it would be. And then same with my requests. So this one will show you like a history of all the requests that have been made, as well as, if they were completed, and if they were just requested, that means that the specialist has still yet to call you back. And then in my profile here, this is where you can sort of set up, your email, your password. It'll also set up the two-factor authentication information. So as Margo had mentioned previously, this has been one of the features that has been added due to after having the upgrades. And then, it'll give you a chance to enter your photo, ask you which sites you support, and then just based on that information, save all of that. And then, again, notify you accordingly based on the request. Go back. And then for my schedules, this is, if you are a specialist providing race coverage, it would show you in terms of what days you have that you are on call to take in the race request. So what I'll do now is I'll just quickly go back to the PowerPoint and just show you the last slide we also have. I'll just share my screen again. So in this slide right over here, sorry, I'll make my screen bigger. So this one here is to kind of give you an idea as to what the specialist would see on their phone as a text message. So here, for example, if we have Miranda, that was the specialist, this is what they would see. So they would see if whether the request has been made, is it complete, has there been a follow-up? And then a specialist would also see this one pop up like notification. So that'll show you, there's a notification on the app, meaning that you may have a request or just another pending item. So that's just to kind of give you like the overview of it. But of course, if you have any questions, we're happy to kind of follow up more on email. So I'll pass it over to you, Margo, or any time now probably for questions.
Yeah, we're happy to take any questions, any suggestions that you might have.
I just had a question. I haven't used Race. I actually just am trying to set up at the moment because I've heard lots of great things about it. After you've spoken with a specialist, do you get a consult note back at all? No. Okay. So you're like, whatever they tell you, you're writing that down as you go. And okay.
Yeah. That's one of the things that was just to keep it as sort of simple advice. It's not really meant to be a consult.
Mm-hmm. Okay.
Yeah. There is a feature on the app and even on the web browser that does let you take notes. And then, it saves it in there for, I think, about a year. And then, yeah.
Okay, awesome. And then my other question, I've used Rudy, which is like the rural emerge. And I remember them telling us that when they're taking on emerge docs that serve Rudy, they specifically look for docs who are friendly. And they assess for that. I was wondering if there's any component of that with race or, but I've heard from friends that it tends to be friendlier than if you're just calling someone on call.
So they're supposed to be friendly, and when the specialists, they actually sort of self-select themselves to be on the race line, and it's not necessarily everybody in the specialty because not everybody really wants to do this. So it's people that we tell them we have 3 criteria. The first one is that they need to be accessible and answer in a timely manner. Second is we say they need to be collegial, but really they need to be nice on the phone, because if someone isn't nice, then you're not going to want to call back, and that just ruins the experience. And the third thing is that they make it an educational discussion so that there's a little bit of information shared there. So yes, I would hope so. And we're more than happy to follow up with anybody if they're not nice. Yeah. Because
Awesome.
that's the whole idea, is that you didn't want people saying, why are you calling me, or stuff like that. Yeah.
Well, that's like it wasn't that long ago that I called someone at like 4:30, so it was near 5. It was near the time that they were going to change, and I got reamed out because it wasn't urgent, and I should wait till tomorrow. And anyway, so it's nice to know that that's not what this experience is at all like.
It shouldn't be. Yes.
Yeah, maybe some feedback and also a question, but I can say that, like, from my experience, I've used it a few times, and every time it's been super friendly and very educational. So I've been very happy with the service. My question is, so last week I actually tried to do a request to speak with a nephrologist, and I've seen that in your, so it is available. So I was able to click on it, but it was, after that I received a message saying that it was not a service available. I don't know if it was just in my region or.
Now, Anosha might need to help me on this. Renal, does theirs go through the phone line? So if you click on renal, it might redirect you. And renal is actually excellent. Certainly the Vancouver ones. It's Adira 11 and Monica Bolio. They pretty much cover the renal line. They are the one specialty that does send you like a note following. And often that note, I think you receive it. I don't know how they do it, but usually maybe like 45 minutes later, you get a note. But Anosha, are you able to look there? Does it say when you click on the app to?
Yes,
I think it's.
believe they also have the phone access to it as well when you click on it.
So we'll look into that for you, and we can. How about we get back to Alyssa? Would that be okay?
Yeah, I'd love to know. Thank
Yeah.
you.
Yeah, but if you do phone the Vancouver one, both Adira and Monica are lovely and absolutely want to help you out.
So normally I'm supposed to see, so on the website, I'm supposed to see different like options. I'm not sure I've seen that. I've seen like a specialist that I'm able to click the specialty, but not a specialist in particular.
No, it's a specialty, but with renal, if it's the Vancouver line you connected with, it's usually one or the other that's doing it. They just share it, and somehow they make it work between the two of them.
So that's the thing for me, it kind of got declined even after, like, even before seeing where I would be dispatched.
Okay, we need to look at that.
Yeah, we can certainly look into that request for sure, and I'll follow up with you on that. Yeah, that shouldn't be happening, so for sure.
And what's your last name?
Duguay, D-U-G-U-A-Y.
Okay, because we can look up to see if there was a request put through too. Yeah.
Perfect. Thanks.
Thank you. Any other comments or suggestions?
Can we just, I don't have any suggestions. Can we just comment on our experience or?
Absolutely.
Right. So I actually use it very seldom because for me, it serves a very specific niche. I don't think for me, it's ever prevented a referral to a specialist or an emerge visit, because that's not who I'm using it for. I probably only call, once a year. And it's when I have a really complex diagnostic dilemma, often that falls between organ systems, and I don't know quite which direction to turn with my next investigation. So I just need somebody to educate me. And I have to say, everybody, 100% of the people that I've talked to have been on the Lower Mainland. They've all been totally welcoming, and they've taught me a ton, way more than answering my question. Like suddenly I get a little mini lecture on I don't know, vasculitis or something. And they just give me the next move. Because to me, if I have somebody who is maybe going to emerge, I would call the doctor on call. And it's true, the doctor on calls are often grumpy, but you know what? They're grumpy for a reason, because they're seeing 3 people and you're calling them. So I've realized, oh, it's got nothing to do with me. They're just being grumpy because, like everybody else, they're overworked. And so it's way nicer to talk to the race people. But just for me, it's a quite a different niche of patient that I'm using it for. And this, oh, and you mentioned that thing where you can send a fax and ask a question. I'm much more likely to do that to a specialist that I have a relationship with.
Mm-hmm.
Or a specialist, or the specialist that patient has seen before. Like maybe it's somebody, the last time they saw their cardiologist was 9 months ago, but now I have a kind of a little, what's the next step query? And so I'll use their specialist. And most specialists, if you send a fax letter to most specialists, you'll get an answer. Yeah, and it'll take up to a week, but up to a week is okay, right?
Mm-hmm. Yeah, and that's what we don't want to interfere with. Like if that person has a cardiologist who knows them, then absolutely that's the way to go.
Yeah, because they can look up the charts. So
Yeah.
I just say I use it very rarely, but it's incredibly useful because in our home, the way our medical system is set up, the biggest challenge I find, if you don't need a CT scan for 3 months, no problem. If you need a CT scan today or tomorrow, I can get you that also, no problem. I know how to make that happen. The challenge is the person who is, I'm going to say subacute, right? Sort of get how to move forward with someone who's kind of stuff is happening in the next week or two.
Mhm.
And it's been really incredibly helpful
That's
and
good to hear.
unbelievably educational.
That's
Yeah.
great.
Yeah, no.
That was a gap it was meant to fill. So I'm really happy to hear that.
And everybody's answered me within 2 hours. And as I said, I don't think I've used it for, it's been more than a year since I've used it. And I don't know why, but everyone's always called me from the Lower Mainland. But that's kind of great too, because I get to talk to somebody new, right? Or experience
Yeah.
something new. And as long as they're nice, which they are, it's all good. Yeah, no, I've been super happy.
Fantastic.
So I have some different comments actually, and it might be partly because I have a long-term practice and I sit with my patients while they're awaiting specialty referral. So I use the race line like once a week, and I am calling palliative care, adult psychiatry, geri psych. So in areas where I have a patient who's subacute, no, they're not going to the emergency room, but they need a specialty visit. And I know they're not going to get that specialty visit for 6 months. And I need some help for my own mental health in order to kind of manage them. And sometimes I'm not going to end up referring to, for some psychiatry. I know they're not going to get a psychiatrist. So I'm talking to the psychiatrist. I think this person's bipolar. I want to start them on divalproex. And what lab work do I need to do? How often? And they will give me the recipe of what to do, how often. And I'm going, yep. So I'd have to say I do addiction, and interestingly, a lot of the times I'm talking to GP specialists. So my colleagues in palliative care, my colleagues in, who do some adult psychiatry stuff, addiction medicine. I do enough addiction medicine to know what I don't know. And it's kind of like, oh, I've got this person here. And what can I get this kind of test, or how do I check for that? Or, all that kind of thing. So, and I do use the specialties. Just recently I had a patient with a parathyroid issue, and I'm going, okay, well, I know it's going to be 6 months before you're seen. Let's get some tests going. So at least when you see the specialist, it's not like, okay, well, now we'll order a scan and now it'll be another 6 months. No, I want you to already have all your workup. And so with the change in the payment model, it's made a huge difference. I mean, before, yes, you could bill for talking to a specialty, but here it's just like in the indirect care, put out the call, I'm doing my paperwork and I get a call back. So, and it's partly, I guess, also, different for my stage of career that I've been in practice for a while. So if I get some advice from a specialist, I'm going, yeah, I can do this too. I can order this scan, I can order this stuff, I can follow up these results. I just need, a little bit of guidance on how to word this request on the radiology form, so I get actually what I'm looking for, because I speak to radiology all the time. Here's what I want to see. Do I order it without or with gadolinium? Do I, I know.
Kathy, can I ask you a question? So do you call a radiologist through race for that kind of thing?
No,
I just call it radio.
But I'm calling people all the time now because everybody's waiting so long for tests. Everybody's waiting so long for consultations. And some of them I know they're going to be like a one-time consult and actually, of limited kind of benefit and stuff like that. But for me, I'm sitting with my patients for months, so I actually just call, we've ordered your parathyroid scan, we've ordered this, I've ordered this lab work, and I can spend time, and I do spend time on up-to-date, but the change in practice for me has been that the wait for specialty, the waits for test is so long. I can't just, I had someone, a locum in who was new, and she said, well, oh, you've got this problem, so I'm going to refer you to nerve conduction studies. Then the patient came to see me and goes, I'm off work. It's a year for nerve conduction studies. Can we do something? And I'm going, yes. We're unfortunately, I have to intervene to move everything along. And, so there was a day and age where you had a question, you referred someone to a specialist. Now I don't do a referral letter, I do a race line consult. And I'd say my referrals to specialists is actually 50% of what it used to be. I just do it myself.
In what kind of time period has that changed, Kathy? Like that 50% decrease, is that?
10 years, over the last 10 years.
Oh, I see.
And
Like,
really, I'd have to say the race line made all the difference. The race line made, like, I'll just talk to an endocrinologist. I will just talk to an adult psychiatrist. I will just talk to someone and kind of take it from there and follow it up. And I'd have to say 90% of the time, their advice means I don't need to do a referral. Yeah.
right. By moving you through to the next step, it's actually, then you can carry on.
Yeah.
That's
Yeah.
awesome.
Yeah.
That's awesome.
Yeah. I know it's this problem or it's not that problem. Okay, now we're over here, but we didn't have to wait 6 months to find out, oh, it's not that kind of thing. It's not
Okay.
that. Yeah.
Perfect. That's great.
I was just going to say, I think my perspective is a little interesting in that I'm on both sides of the equation. So when I'm wearing my family medicine hat, I use race similar to Kathy all the time, multiple times a week. And then I put on my palliative care hat and I answer race calls. So as a user of it, I moved here 7 years ago now. So I still feel new, but I don't know how long I'm allowed to say that for. But I'm relatively new still. And because I didn't train here, I didn't go to medical school here, I didn't do my residency here. I worked in Ontario for 15 years before I moved here. I don't know all the specialists. I don't know how the system works here. And so the beauty of race as a GP is I don't have to figure out who does what in town. I can just call race. Whereas where I trained, I knew all that magic because I had been in the building. I had done rotations under those people. So, and it's amazing how much you don't recognize the value of that when you relocate and realize that you know nobody. So for somebody who knows nobody, race for me has been huge as a user. In terms of being somebody who answers the call, I love it. I would rather spend 45 minutes, 10 minutes, 3.5 minutes, however long you want, talking to a family doctor about how to provide the care than doing it myself, especially in palliative care. So that's part of the reason, but I am thrilled to get race calls. And so, yeah, this is a plug for anybody who's looking for palliative advice, call us, we love it. But yeah, I think it's, and usually I think, generally, I would say probably 75% of the time with palliative care, we avoid referrals to us. We actually divert the referral by just giving advice. Occasionally things are super complex and we end up having to see the patient, but often we're able to divert it. And I think it's because a lot of people with something like palliative care, if it's not something you do every day, you may know, but you're just not sure. And so it's kind of like phone a friend and you can just get the support and certainty, right? Like give you the confidence boost, because if it's not something you do all the time, I like to think I do a reasonable amount of trans care, but I don't do enough of it to feel super confident with it. So I use race all the time to call trans care, whoever's on call for trans care, about weird side effects, or like, I didn't know that this variation of estrogen can cause this side effect in trans women, and I don't do enough of it to know that for sure. And so I want to be confident. So I think that has value for me as well. So I love race.
when you're answering calls, when you're on, are you being called every 5 minutes? Are you being called twice a shift? Are you being called like, because one of the things I'm always conscious of, just the way that I am with on-call specialists, I feel really respectful, or I feel I should be very respectful of the people that are providing the service. Because in general, just in our whole community, everyone's overworked and busy. And so I want to make sure that I have a good reason to call. So just give me a sense of how busy you are when you're on.
Well, palliative care, we're not very busy. To be honest, I don't get a call every time I'm on even.
And when you're on, are you on for a day or for a week, or how do you guys have it set up?
Well, we've decided to do it. Whoever is covering the community consult service is also on for race. So
Okay.
we're the one who, so we're also, so the 2-hour window for us, we get back to people, we try. I would be interested in knowing our stats actually, in terms of, do we always make it 2 hours? Because we're doing home visits. And so if I'm in a home, I'm not going to step out from a home to answer a race call. Which makes our timing a bit off. The other thing that's handy about race is that because I already have the PHN and the date of birth, before I call you back, I've already pulled that patient up on Power Chart. So I try to get a sense of what the patient has, what their diagnosis is, and what the issues may be, because otherwise it takes too long to dig through it while we're both on the phone. And I do that out of respect for your time. I know that you don't want to go through the whole spiel with me. So if I can find out a little bit about the patient before we even start, that can be helpful sometimes.
Yeah, I've actually found specialists when I call them, they've already got the patient's CT and life labs and everything, like, because they've already done that before they called me. So they go, okay, so what's the question? But they already know. They've already done their stuff on the patient. Yeah. So my time with them is, again, not, here's where the scan is or stuff like that. They've all the local ones have pulled everything up on Power Chart already. Gastroenterology has already, GI does that all the time. I see they had a scoping here, they had this then, they had that then. They had an ER visit. I've already looked at their CT scan by the time they call me back. I've looked at their MRI or whatever. Yeah.
And for our host people, so when I go on being on Vancouver Island, am I being given the choice of choosing a Vancouver Island person? And if that doesn't work out, I go to a BC-wide person, or the system chooses it for me?
You would have the ability to choose, because
I'm just curious.
At one point we thought, okay, if someone calls from or is looking for someone to talk to from the north, would we, if the specialty is not available in the north, would we send them to Fraser, because that's kind of the next closest. But then we just thought it's not up to us to direct it. It should be the person's choice who they connect in with, if the specialty is not available. So you would be able to choose. And I think it's usually written down as something like Fraser Cardiology or Vancouver Cardiology, I believe. Right, Anosha?
Or BC-wide. Some of them are BC-wide cardiology. That's also a choice.
Some of the specialties are fully provincial, and that would just show up on your like on what's available to you, for sure. Right. But something like Hematology Island would only show up to island people, because they're just too busy to open themselves up beyond the island.
Then that's the choice that they've made.
Yes, they've chosen to opt in to, if the specialty is not available, to make themselves available, or to opt out, and totally understand when they just can't do it.
And so when I've spoken with specialists on the mainland, it's because they're in a group, I'll say, or in their specialty, those guys have elected to open themselves up, well, maybe to Vancouver Island, maybe to all of BC, but it's their choice that they are willing to take a call from Vancouver Island.
Yep.
Great. Okay.
Yep.
Super.
And most of them did, I think. Some of them just didn't feel they had the capacity to do that. So a few of them haven't, and totally understand the island, and totally understand the north too, because there might only be one specialist up there in the north for a particular specialty. So if they don't have the capacity, it's totally fine.